Khairi Jamaluddin warned of a new COVID-19 wave sooner than expected, as Malaysia sees a rise in cases. How bad will it be, and what can we do to prepare for it? We ask public health specialist Prof Dr Sharifa Ezat Wan Putih.
There's a lot of cause for this rise in cases. I think the biggest so-called elephant in the room would be, we are not complying to our SOP as were before. And this is in concordance with our endemicity. Remember, we talk about endemic and things like that. Going into endemic status, we have basically dropped a lot of SOPs. This includes, working from home. This includes closure from schools and things like that. And one of the reasons for that is actually to boost the economy. And basically, everybody is going back to their normal society, social things, and so forth. So there's a lot of reason for that. So these are one of the reasons why there's an increment of cases. Basically, you get more transmission when you go around, you mix with a lot of public and things like that. So this is happening everywhere in most of the countries as well. So the risk is there. I don't think it's going to be as bad as our previous second wave or third wave and things like that, because we have had our mass vaccination. The herd immunity basically kicks into place. But we have to be careful as well, because we know that, once we are vaccinated, the vaccines efficacy basically wanes over time. When 6 months, 4 months, some have even stated as 4 months, 6 months, our vaccination basically reduced. There's different percentages. Some will say decreasement in 20%, 40%, and so forth. So meaning that we are exposed.
Dr. Sharifa also emphasized the need for everyone, especially those in high-risk groups, to be vaccinated and even boosted. While vaccination is still voluntary, a more aggressive stance may be necessary if the situation worsens.
Our coverage for boosters is still, like 50%, so we can increase that. The coverage for prime vaccination for children is still well below 40%, which we also can increase that. But also to maintain your SOPs and basically maintain the usual, sanitary, washing hands, wearing your mask in areas where, you don't have a lot of ventilation and so forth. We have not seen the full impact yet in Malaysia, and we thank God for that, and hopefully that we don't get a full-blown, but other countries have already really stepped up going into your second booster. They have things like Italy, Turkey, all have started into very aggressively vaccinating at-risk population. So I would recommend at Malaysia to do the same. But again, at this point in time, it is very much voluntary. Basically we don't carry around sticks and say that you get vaccinated. So this is more of increasing your awareness for the population. And knowing your options are to get vaccinated at one point in time. If the cases becomes high, and we hopefully that doesn't happen, or the healthcare is basically overwhelmed, the possibility is always there. Then probably we need to be more aggressive and forcibly maybe or encouraging people to be vaccinated in again for the fourth dose and things like that.